I'm here today to announce a new policy that will end criminalization of pregnancy for people struggling with substance use in Hennepin County. Standing with us today is Dr. Cresta Jones, an associate professor at the University of Minnesota Medical School who specializes in high-risk pregnancy care. She co-chairs the Minnesota Maternal Mortality Committee. Also standing with us today is State Representative Esther Agbaje, who chairs the Minnesota House Black Maternal Health Caucus. We know that drug use during pregnancy is a serious concern. To some, it might seem that charging people for using drugs while pregnant might stop drug use. But the opposite is true. Threatening serious punishment for pregnant people with an addiction doesn't stop or treat that addiction. To the contrary, our current system of charging and punishing pregnant people with substance use problems actually causes tremendous harm. People who are struggling with drug addiction while pregnant will simply never try to get the help that they need. They will suffer, and so will their children. This isn't hypothetical. Research shows that this is true. Our society claims that it values children more than anything else. We therefore must provide a safe space for those who are struggling to seek treatment while they are pregnant. And yet for too long, we have put pregnant people in jail and prison as our first and not our last resort. Today, that will change in Hennepin County. Under our new policy, the Hennepin County Attorney's Office will no longer criminally charge people who engage in drug use during pregnancy. Any pending cases will be dismissed. And we will advocate for and continue to work with our partners to push for increased services in our community. We believe this is the best way to help protect our children and those who carry them for 9 months. Finally, while state law doesn't currently allow prosecutor-led expungement in these cases, we will support a petition for expungement made by people who were previously charged. This new policy is effective immediately. Some may say that we are condoning drug use while pregnant. Let me address that criticism immediately. In our office, we look at actual research before making policy decisions. Threats of prosecution mean pregnant people do not get help, and they continue using. This new policy gives us the best chance for helping to ensure that people carrying our next generation are able to get the help that they need and that their children can have the best opportunity to succeed. Next up will be Sarah Davis, Deputy Hennepin County Attorney, and she heads our office's Children and Families Division.
Drug addiction should not be a crime, but it is criminalized when a person is pregnant. That's not how it should be. No one benefits. Pregnant people who are struggling with addiction need help to stop using. But when we criminalize their addiction, we all but ensure that they will never receive it. We have seen firsthand in our work here in this office that pregnant people and new parents who are struggling with substance use and face criminal charges as a result will not reach out for the support that they need and will avoid critical doctor's appointments, treatment programs, and child protection court hearings for fear of being put in jail. If we truly care about improving outcomes for children and families, we must take a health-focused approach to treating substance use. Addiction is complex and difficult. Perinatal substance use disorder, using drugs while pregnant, is a health issue. People don't suddenly stop suffering from addiction because they're pregnant. We certainly wish it were otherwise, but that's just not how it works. Research shows that when we punish people for addiction while pregnant, we actually make things worse. It leads to pregnant people not getting the help and care that they need, and in light of the significant racial disparities in both our criminal legal system and our child protection system, criminalizing pregnancy for people struggling with substance use has a hugely disproportionate negative impact on pregnant people of color. We know from research that people of all racial identities engage in substance use at similar rates, but that people of color are significantly less likely to receive treatment. If we care about pregnant people, and if we care about their unborn children, we have to change this trajectory. We need to reduce barriers and improve access to treatment. That's why we are announcing a new policy today. This new policy is a result of significant collaboration between our criminal prosecution and child protection divisions. I want to thank our teams for their work on this. And it reflects our office's research-based problem-solving approach focused on improving outcomes. Experts from the American College of Obstetricians and Gynecologists, the National Perinatal Association, the American Society of Addiction Medicine, and the American Nurses Association all agree. Criminalizing pregnant people for substance use has a negative impact on the health of the baby and the parent. Instead, we must improve access to treatment. This new policy does just that. It doesn't compromise the safety of infants. Instead, it makes prenatal health care more likely. It shifts the focus from punishment to treatment and will improve outcomes for children and parents. Next up, we have Dr. Cresta Jones, an associate professor at the University of Minnesota Medical School, who specializes in high-risk pregnancy care. She also co-chairs the Minnesota Maternal Mortality Committee.
Thank you. I want to thank Hennepin County Attorney Moriarty and her team for the policy change announced today. I'm a physician here in Hennepin County and a Hennepin County resident, and I care for patients who are both pregnant and experiencing addiction, or what we now call substance use disorder. I can speak firsthand to the challenges that my patients face every day, not only from having a health issue that remains highly stigmatized, but from worrying about what it means to have a medical condition that is criminalized when they are pregnant. Today's change will be instrumental in optimizing care for my patients and for their pregnancies. When I see pregnant patients who are struggling to control high blood pressure or diabetes, our response is to help them get treatment. This has historically not been the case with substance use disorder during pregnancy, even though it is also a chronic medical condition. Punitive policies for drug use in pregnancy do not stop people from using drugs, nor do they improve pregnancy outcomes. In fact, they often worsen pregnancy outcomes. I have personally seen my patients scared to seek medical attention until they are in labor and going to give birth, at which time it becomes much more challenging for us to start treatment. We know that if patients who are struggling with substance use disorder come in earlier for pregnancy care, outcomes will be better for them and better for their pregnancies. Data show that if patients with addiction are able to access regular pregnancy care, even if they have ongoing substance use, they are more likely to deliver their babies at full term and to have babies who are normally grown. In addition, they can be connected with treatment for their substance use disorders before they give birth, which we know will reduce their risk of a drug overdose after delivery. As a member of the Maternal Mortality Review Team here in Minnesota, I can also speak to the significant role that untreated addiction plays in Minnesota maternal deaths. If we can allow patients to access treatment without fear while they are still pregnant, we will allow for less children to grow up without the loss of a parent due to a fatal overdose. Today's action by the Attorney's Office will further allow pregnant people to feel more comfortable in accessing obstetric care and addiction care without fear of experiencing criminal charges for a medical condition. Thank you.
Thank you, Dr. Jones. Next, we'll hear from Representative Agbaje.
Good morning. My name is Esther Agbaje, and I represent House District 59B that covers parts of North and downtown Minneapolis. And I'm glad to be here with all of you this morning as the Hennepin County Attorney announces this policy to help pregnant people in their struggles with addiction rather than to punish them. Addiction can be a lifelong affliction, and the reasons for it are varied, as we've heard. But yet what we do know from the data is that criminalizing drug use for pregnant persons is not working. It leads to further family separation and does little to help that person overcome their addiction. Instead, policies like the one implemented today show that what does work is treatment. What does work is compassion. What does work is letting people know that if they need help ending their addiction, they can do that without fear of other detrimental repercussions like jail or prison on their road to recovery. As the chair of the House Black Maternal Health Caucus, our goal is to ensure that Black women are not inordinately harmed by our laws or the implementation of those laws during their pregnancy and in postpartum. As noted, the criminalization of pregnant people disrupts everyone's lives, and unfortunately, we see high disparity rates in our Black and brown populations. And I do hope that this policy will help in ensuring that everyone is treated fairly according to the law and that get the help that they need. And I'm also grateful to Hennepin County Attorney Mary Moriarty for taking on this policy. And while we do as much as we can at the legislature, it takes our partners across government to ensure and implement policies that achieve better outcomes for more people. And I am glad that Hennepin County is leading the way on providing treatment for those who need it and diverting people away from jail and prison who do not need to be there. By focusing on harm reduction and treatment rather than punishment, we can create a safer environment for all families across Minnesota. Thank you.
Before we open it up to questions, I think it's important to talk about the need for treatment that allows the infant to stay with the parent. That is critically important. This is just a first step, and we will be advocating along with partners to try to urge all of our partners to provide that treatment, as I said, so that when a parent needs treatment after birth, they can stay with their infant. That is healthy, and that's the best practice for both the infant and the parent. Thank you. Questions?
Will there be outreach or communication, because even though there's this policy change, there's going to be distrust there?
Yes. As I said, we are going to dismiss the cases that we have. Jen White is the head of community engagement and community affairs, and we will be talking about how we can reach out to community members so that they know about this policy, because you're right. It's the perception that people will be charged, will be criminalized, and if this policy is there but people don't know about it, it won't make a difference. So yes, we will be engaging in community outreach.
How large is this problem? Do you have numbers? I mean, how many people will be expunged? How many people generally are charged with this crime?
Because our system tagged these cases along with child abuse, child neglect, there's no way of pulling these cases. We do have a list of pending cases, but it's hard to say because we can't pull out just these cases. And I will say, there's no way really, I mean, Dr. Jones is in the best position to talk about this, but there's no way to measure the people who were afraid to come forward to get care because they feared that they would be criminalized.
So when you talk about dropping the charges that are
Yep.
pending, are we talking 5, 6? Are we talking 40, 50? I mean,
Okay. It is about 40 cases, which includes cases that have been submitted to us but not yet charged.
So these women that are pregnant, when they have their kid, what's going to happen to the baby? I mean, we've heard of crack babies, we've heard of whatever the mother is on when the baby's born. The baby has this problem too.
Well, what we know,
What are we going to do with the baby when the baby's born?
well, what we would like to do is to provide the support and treatment that both the baby and the parent need. We know that babies can be born and suffer from withdrawal symptoms because they've been exposed. They are cared for by Dr. Jones and others. But the key here is to encourage people who are pregnant to come forward for care that will help the health of the baby and the parent. Child protection is an option. Lori Whittier, who's the head of our child protection team, is here. Child protection is always an option, and if it is appropriate, child protection can intervene. The law did change in 2022, which allows mandated reporters the support that they need. But as I said, we need more of those types of treatment supports.
What's the precedent for this, with the state and
In terms of the state, I'm not aware of any other county adopting this policy, but I am aware nationally that other district attorneys, other county attorneys' offices have adopted similar policies. And as I said before, we base every single policy we have on research and the actual data and experts such as Dr. Jones. We want to make sure that we are adopting policies that are going to help. They're going to help the infant and they're going to help the parent thrive. And that is why we're adopting this policy.
If part of the policy is coming into place to help reduce family separation, what are the options for mothers and children to be able to stay together if a mother is dealing with any substance abuse? And are there places for them to go in the Twin Cities so they're not going to be, so mothers and babies will not be separated?
I understand.
I'm happy to So one of the most important things we can do both when people are pregnant and then after they give birth is to have family-centered treatment programs. That is someplace where we certainly see a deficit in the Twin Cities and in greater Minnesota. The programs we have are outstanding, but they're small and money is often tight. And so I think having an effort to support and make people aware of how helpful that treatment can be. Someone's just given birth, they have a new baby, they're in a supportive environment that helps them learn parenting skills, how to best manage their substance use disorder, how to remain in recovery, setbacks that they may have if they return to use. We need those programs and we need to expand them because we've got lots more pregnant people than we can accommodate at this time.
Thank you, Dr. Jones. Any other questions? Yes.
Can you explain how these charges used to come to light? Like, what would the pregnant mother be charged with? Was it what is the existing policy that's being overturned?
Well, those would be looked at a case-by-case basis. They would be submitted to us. My understanding is that most came from MPD, who would probably be alerted by the hospital, I think. And so those cases would come to us. And we have used diversion programs in the past, but as you pointed out as well, just the idea that a pregnant person might face criminal charges is enough to deter them from seeking the prenatal care that they need. So our policy in the past had been to try to look at individuals, try to help, and we just realized, given the research, and one thing I will say, in other states that have criminalized pregnancy in this way, within just a year, you see a huge increase in babies that suffer from those withdrawal symptoms because they've been exposed. So we can see from other states that these policies do not help. In fact, they make outcomes worse.
So this is an intersection where this is a public health initiative as much as it is a prosecutorial kind of.
It is very much a public health initiative, and that is how we have been trying to approach substance use across the board. We have Chris Freeman, who is the head of our community prosecution team at one time, and that's the team that gets a lot of our drug cases. So we have been trying to shift our approach to be one of public health, because we know that criminalization just does not deter substance use. And what we need to do is to help people struggling with substance use to make sure that they are receiving the supports, the effective supports that they need to be healthy.
Just because I was unfamiliar with this law before, you're talking about eliminating prosecution for pregnancy. And does this carry over at all into post-pregnancy?
I'm not sure I know. I mean, this particular policy means that we will not be charging people who use drugs while they are pregnant. So these are situations where the baby is born and the baby has some indications of withdrawal. And so the thought is that, and the parent may very well have been using drugs. So that's what this particular policy is about. Did that answer?
Yeah, but so it does not carry over to 3 weeks after the baby's born, if the mother starts using again or continues using?
Yeah, so we still have a very robust child protection system in place. And so if there are other issues with the parent involving neglect because of use or something, nothing about this is changing that. So we still have a robust system to protect both the child and the parent. This is simply making it, us taking a health approach to try to encourage those outcomes to be better. But there are systems there that are still there that are going to support the infant and the mom or the parent. Yeah, we are here today to talk about this. This is an incredibly important initiative. You know, what I said earlier about children, we often talk about how children are our most important asset, are our future, but we don't spend enough time really focusing on how to make children healthy. And so that's really what we're trying to focus on this morning, and we believe this policy will help both children and parents. Thank you so much.
So you